Hey everyone, I'm Dr. Sana Ansari. Welcome back to my channel. If you are someone who is preparing for MRCOG Part 2 exam, I'm sure this video will definitely help you out. Now in today's video, I'll be discussing in detail about what is MRCOG Part 2 exam format, the eligibility criteria, and what are the topics covered in Part 2 exam. So let's start. Number 1, what is MRCOG Part 2 exam? Unlike Part 1 exam, which was theoretical, Part 2 exam, it is clinical. They'll give you real life clinical scenarios and they'll test your clinical judgment. So you have to think like a clinician to be able to answer those questions correctly. But don't worry, if you're already in practice in a hospital or a clinical setup, I'm sure that will definitely help you out. Now secondly, what is the eligibility criteria? If you have passed MRCOG Part 1 exam, then you are eligible to give Part 2 exam. Previously, there was one more criteria, like you have to have 4 years of clinical experience in obstetrics and gynecology. But now that is not for Part 2 exam, that is for Part 3 exam. So you just have to pass Part 1 exam, then you can give Part 2. Now coming to the exam format. MRCOG Part 2 exam, like Part 1, it is a clinical computer-based written exam. It is conducted at Pearson Center worldwide and it is conducted twice in a year. So it has 2 papers, paper 1 and paper 2. Each paper is of 3 hours each. Each paper has 50 SBAs and 50 EMQs. Now SBAs are single best answer questions, which are like MCQs that you did in Part 1 exam. You have to choose one correct option among 4 to 5 options. Now EMQs is something different. It stands for extended matching questions. They'll give you a long clinical scenario and a long list of options, and among those options you have to choose the correct option. So that is something different and difficult. So they'll test your clinical judgment and your clinical concepts should be clear and crisp. You cannot just memorize the topic. It's like that. Now the number of attempts which you can give for Part 2 exam are maximum 6 attempts you can give. But the good thing is there is no negative marking in the exam. Now coming to the next thing, what are the topics covered in MRCOG Part 2 exam? So Part 2 is all about UK guidelines, RCOG guidelines. What all guidelines are important? The most important one is Cream Talk guideline. Second most important is NICE guideline. Then there is Talk guideline and patient information leaflets. So all these guidelines you have to study. What all areas you have to cover in the guidelines are antenatal, intrapartum and postnatal care, maternal medicine, fetal medicine, then there is oncology, gynecological disorders, reproductive medicine and urogyne, ethics, and then there is clinical governance. So all these areas, they are to be covered, and that too thoroughly. I know it's a long list, but don't worry. In my next video, I'll be covering in detail how to prepare for Part 2 exam efficiently and what challenges I faced and what I did to overcome all those challenges. So if you have any doubt in preparing for Part 2 exam, let me know in the comment section. I'll be happy to help. Good luck, all the best. Thank you.